Blood hit the floor of OR4 with a sickening smack. The monitors screened a flatline warning. At the table stood Boston's greatest iliothoracic surgeon, staring blankly, utterly paralyzed. The patient was dying. That's when a 24-year-old rookie nurse grabbed the clamp, shoved the legend aside, and broke every rule. The hierarchy of a surgical operating room is as rigid as the military. At the very bottom are the medical students, allowed only to breathe quietly and hold retractors until their arms go numb. A step above them are the junior nurses, glorified tool fetchers whose primary directive is to be fast, invisible, and flawless. And at the absolute pinnacle, functioning with the unquestioned authority of a deity, is the chief surgeon. At Boston General Memorial, that deity was Dr. Derrick Richard Sterling. To call Dr. Sterling a legend was an understatement. He was the man who had pioneered 3 different minimally invasive valve replacement techniques before his 50th birthday. He had the kind of steady hands that surgical residents whispered about, and the cafeteria hands that could supposedly thread a needle in the dark while on a roller coaster. He was cold, aristocratic, and fiercely unforgiving of mistakes. If you handed him a DeBakey clamp when he asked for a Kelly, you didn't just get yelled at, you got banished from his floor. Chloe Jenkins knew all of this. It was precisely why she was currently staring into the mirror of the women's locker room, trying to stop her hands from trembling. Chloe was 24 years old, 6 months out of her accelerated nursing program, and drowning in imposter syndrome. She had bright, exhausted hazel eyes, dark hair scraped back into a tight, sterile cap, and a sinking feeling in her gut. She wasn't supposed to be here today. She was scheduled to circulate a routine appendectomy in OR2, but an outbreak of the flu had decimated the surgical nursing staff overnight. At 6 a.m., the charge nurse had grabbed Chloe by the elbow and rerouted her. Sterling's primary scrub called out. "You're filling in," the charge nurse had said, brooking no argument. "Don't speak, unless spoken to. Hand him exactly what he asks for before he finishes asking for it. And for the love of God, Jenkins, don't drop anything." Now, at 7:45 a.m., Chloe stood at the deep stainless steel scrub sink outside OR4. Beside her, washing his hands with the methodical, rhythmic precision of a metronome, was Dr. Sterling. He wore custom-fitted lead glasses. His graying hair was perfectly concealed beneath his cap. He hadn't so much as glanced at her since she arrived at the sink. "Good morning, Dr. Sterling," Chloe managed to squeak out over the rush of the water. Sterling didn't look up. "Are you the replacement?" His voice was a deep, gravelly baritone that echoed off the tiled walls. "Yes, Doctor. Chloe Jenkins." "I don't need your name, nurse," he said, turning off the water with a bump of his elbow. "I need your absolute concentration. Today is not a textbook simulation. This is Arthur Pendleton." Chloe swallowed hard. Arthur Pendleton. The name had been buzzing through the hospital all week. Pendleton was a prominent city councilman, a father of 3, and currently harboring a massive ticking time bomb in his chest, a dissecting, descending thoracic aortic aneurysm. His aorta, the main artery carrying blood away from the heart, had ballooned to a terrifying size. The walls of the artery were thinning, stretching to the point of imminent rupture. It was a high-stakes, 8-hour operation that required placing the patient on a cardiopulmonary bypass machine, stopping his heart, and replacing the diseased section of the aorta with a synthetic Dacron graft. The mortality rate for this surgery, even in the best hands, was daunting. In the hands of anyone but Sterling, it was almost a death sentence. Chloe backed through the swinging doors of OR4 with her dripping hands raised. The room was freezing, kept to the crisp 62 degrees to minimize bacterial growth. The sharp, metallic scent of iodine and sterile draping filled the air. The room was already buzzing with intense, focused energy. Dr. Gregory Finch, the veteran anesthesiologist, was pushing a cocktail of sedatives and paralytics into Arthur Pendleton's IV line. The perfusionist, a quiet man named Thomas, was priming the bypass machine, ensuring the tubes were clear of any fatal air bubbles. "Patient is under. Vitals are stable, Doctor," Finch called out from behind the blue drape separating the patient's head from the surgical field. "Pressure is 110/70. He's all yours, Richard." Sterling stepped up to the table. Chloe took her position across from him, standing over the Mayo stand, which was meticulously organized with dozens of gleaming, sterilized stainless steel instruments, scalpels, forceps, clamps, retractors, and needle drivers. "Scalpel, 10 blade," Sterling commanded. He didn't extend his hand, he just kept it hovered over the patient's chest, expecting the instrument to magically appear. Chloe snapped the scalpel into his palm, slapping it firmly enough so he could feel the weight without looking. "Sternal saw," he said a few moments later. The high-pitched whine of the bone saw filled the room, followed immediately by the acrid, unmistakable smell of burning bone dust. As Sterling split Pendleton's sternum, Chloe moved like a machine, her initial terror giving way to the muscle memory drilled into her during her grueling clinical rotations. She handed over the Finocchieto retractor. Sterling cranked it open, spreading the rib cage to expose the beating, vulnerable heart and the massive, angry bulge of the aneurysm just beyond it. For the next 3 hours, the surgery was a masterclass in surgical precision. Sterling was brilliant. He moved with a brutal efficiency, wasting no motion. He cannulated the heart, inserting the thick plastic tubes that would drain Pendleton's blood into the bypass machine. "On bypass," Sterling announced. "Cross-clamp the aorta. Administer cardioplegia." A cold, potassium-rich solution was flushed into the heart muscle. Within seconds, Arthur Pendleton's heart fluttered and stopped dead. The rhythmic beeping of the EKG flatlined, replaced by the steady, artificial hum of the bypass machine pumping oxygenated blood through the man's body. They were now in the most critical phase. The clock was ticking. They had a limited window to cut out the aneurysm, sew in the synthetic tube, and restart the heart before the lack of natural blood flow caused irreversible organ damage. "Bistering knife," Sterling muttered, leaning in closely. Chloe slapped the delicate knife into his hand. Sterling made the first incision into the aneurysmal sac. That was the exact moment everything changed. The tissue of the aorta wasn't just thin, it was fundamentally necrotic. As Sterling's blade touched the stretched wall of the artery, the diseased tissue gave way completely. It didn't tear cleanly, it disintegrated. A sound like tearing wet canvas echoed in the quiet room. Before Sterling could even retract his blade, the compromised section of the aorta blew open. The arterial pressure, still being artificially maintained by the bypass machine, found the path of least resistance. A geyser of dark crimson arterial blood erupted from Pendleton's chest. It shot upward with terrifying force, splashing violently against Sterling's face shield and painting the front of his sterile gown red. The surgical cavity instantly filled with a blinding pool of blood, obscuring the heart, the lungs, and the ruptured vessel. "Damn it! Doctor! Lasders!" Finch shouted from the anesthesia monitors as the alarms instantly began to shriek. "Pressure is tanking. We're losing volume rapidly. Suction. Get 2 suction lines in there now." Sterling barked, his voice tight but controlled. Chloe practically threw the rigid plastic suction wands into the cavity, the machines gurgling loudly as they struggled to clear the massive hemorrhage. But the blood was pooling faster than the dual lines could remove it. "He's bleeding out, Richard!" Finch yelled over the blaring alarms. "Mean arterial pressure is dropping past 40. If you don't clamp that tear right now, he's going to stroke out on the table." "Satinsky clamp!" Sterling demanded, holding out his right hand, his eyes locked on the dark, bubbling lake of blood in the patient's chest. Chloe grabbed the large, curved vascular clamp. She slapped it into Sterling's waiting palm with practiced force. Sterling gripped the heavy steel clamp. He lowered his hands toward the open chest cavity, his eyes narrowing as he tried to visually locate the exact source of the rupture beneath the swirling blood. He needed to apply the clamp blindly, using feel to pinch the aorta shut below the tear to stop the massive hemorrhaging. He lowered the clamp. It hovered an inch above the bleeding chest. And then, Dr. Richard Sterling stopped moving. It didn't happen gradually. It was as if someone had brutally pulled the plug on a machine. His broad shoulders went completely rigid. The fingers of his right hand, gripping the vital clamp, locked into place in midair. "Dr. Sterling?" Chloe asked, her voice muffled behind her mask. Sterling didn't blink. Behind his blood-spattered face shield, his eyes were dilated, staring fixedly at the pool of blood, but seeing absolutely nothing. A heavy drop of sweat rolled down his forehead, stinging his eye, but he didn't even twitch to blink it away. "Richard!" Finch screamed. The monitors were flashing a violent strobe light red. "Pressure is at 20. He's dying. Clamp the damn aorta." 10 seconds passed. In a massive hemorrhage, 10 seconds is an eternity. A liter of blood had already been sucked into the canisters. "Dr. Sterling, you need to clamp it," Chloe said, her voice rising in panic. She leaned over the table, looking at the chief surgeon. His breathing was incredibly shallow. His skin had turned a waxy, terrifying shade of gray. Was it a massive heart attack? A transient ischemic attack, a mini-stroke? Or was it a psychological break? The veteran surgeon, the legend of Boston General, was locked in an impenetrable state of catatonia. What the hell is happening? Finch roared, standing up from his stool and peering over the drape. Why isn't he moving? Jenkins, what is he doing? He's unresponsive, Chloe yelled back, panic finally clawing at her throat. He's frozen. Get him out of the way. Get another surgeon in here, Thomas the perfusionist yelled, frantically turning dials on his machine to try and push more fluids into the dying man. There's no time, Finch screamed. By the time someone scrubs in, Pendleton's brain will be mush. He has maybe 30 seconds before irreversible anoxic brain injury. The operating room devolved into absolute chaos. The alarms were a deafening, overlapping cacophony of death. The suction machines hissed. Finch was shouting into the phone for emergency backup, but no one at the table moved. The medical hierarchy had paralyzed them. A scrub nurse does not operate. A nurse does not clamp an aorta. To cross that physical and professional line was not just grounds for immediate termination. It was assault, malpractice, and a guaranteed revocation of her license. If she touched that clamp and Telton died, Chloe Jenkins would likely go to prison. She looked at Sterling. He was a statue. She looked at the monitors. The numbers were dropping to 0. She looked at the man on the table, a father of 3, a man who trusted them to save his life. 30 seconds. Chloe's heart hammered against her ribs like a trapped bird. Her breathing grew ragged. The sterile rules, the fear of the chief surgeon, the threat of ruin, it all vanished under the crushing, undeniable weight of a dying man's blood. Screw the hierarchy, she thought. Chloe stepped around the Mayo stand. She didn't ask for permission. She didn't hesitate. She stepped directly into Dr. Sterling's space and drove her shoulder hard into his chest. The heavy impact knocked the catatonic surgeon off balance. Sterling stumbled backward, his grip loosening just enough. Chloe snatched the Satinsky clamp right out of his rigid hand. Her collective gasp sucked the remaining oxygen out of the OR. Finch stopped shouting into the phone. The perfusionist froze. "Jenkins!" Finch yelled, his voice cracking with shock. "What the hell are you doing?" "Step away from the table. He's bleeding out." Chloe screamed back, her voice tearing through the room with an authority she didn't know she possessed. "Keep pushing volume." Without waiting for a response, Chloe plunged her hands directly into the blinding, hot pool of blood inside Arthur Pendleton's chest. The heat of it soaked through her sterile gloves instantly. She couldn't see anything. The blood was rising too fast. She had to do it entirely by touch. She closed her eyes, blocking out the screaming alarms and the panicked shouts of the men around her. She relied entirely on the anatomical diagrams burned into her brain from late-night studying. Her finger slipped past the cold, still muscle of the heart. She reached deeper, sliding down the slippery, fibrous tissue of the thoracic cavity. There, she felt the spinal column. She moved her fingers slightly to the left. A thick, muscular tube pulsed weakly under her fingertips. The descending aorta. She slid her fingers upward, feeling the smooth, healthy tissue give way to a ragged, shredded texture. The tear, she felt the violent rush of blood jetting from the rupture, pushing against her gloved fingers. With her left hand, she pinched the aorta tightly just below the tear. With her right hand, she guided the heavy steel Satinsky clamp down her own wrist, sliding it deep into the chest cavity until she felt the jaws of the instrument resting on either side of the artery. She took a breath, prayed to whatever was listening, and clamped down hard. The heavy ratchets of the surgical clamp clicked into place. Click, click, click. Chloe opened her eyes. Suction? She gasped, her hands still buried inside the man's chest. For a second, nobody moved. Then the circulating nurse snapped out of her shock and sprinted to the table, grabbing the suction wands. The blood level in the cavity began to drop. The violent, bubbling geyser had stopped. Finch, Chloe breathed, her voice shaking violently now that the adrenaline was cresting. Vitals. Vitals. Silence stretched from behind the drape. And then Dr. Finch let out a ragged, disbelieving exhale. Pressure is stabilizing. Mean arterial pressure is climbing. 60, 70. You got it. Jenkins, you actually got it. Chloe looked across the table. Dr. Sterling was leaning against the tiled wall of the OR, his chest heaving, his eyes wide and panicked, as if he had just woken up from a violent nightmare. He looked from his empty hands down to the patient, and finally up to the 24-year-old nurse, whose hands were buried in his patient's chest. But the ordeal wasn't over. The bleed was stopped, but the aneurysm still needed to be repaired, and the chief of surgery was completely broken. Chloe was holding the line, but she couldn't sew the graft. They were standing on a knife's edge, and the clock was still ticking. Within 2 minutes of Chloe Jenkins clamping the ruptured aorta, the heavy double doors of OR4 flew open. Dr. Thomas Hayes, the hospital's formidable deputy chief of surgery, practically sprinted into the room, his hands already dripping with iodine from a rushed scrub. He took one look at the scene, the monitors stabilizing, the pool of blood being suctioned away, the pale, hyperventilating chief surgeon slumped against the wall, and the 24-year-old rookie nurse with her hands buried inside the chest of Councilman Arthur Whitaker. "Don't move a millimeter, Jenkins, Doctor," Hayes barked, stepping up to the table. He leaned over, inspecting the precise placement of the heavy steel Satinsky clamp. He let out a low, impressed whistle behind his mask. "You've got a millimeter of healthy tissue below the tear, but you got it. Now, step back slowly. Let me take the field." Chloe carefully slipped her blood-soaked hands out of the chest cavity, relinquishing the space to the veteran surgeon. As she stepped back, her knees finally buckled. She caught herself on the edge of the Mayo stand, her entire body shaking with violent tremors as the massive spike of adrenaline began to metabolize. Dr. Hayes took command with brutal efficiency. "Raft is compromised. Get me a new Dacron tube. Let's clean up this mess and sew him up." For the next 4 hours, Chloe stood in the corner of the operating room, entirely forgotten. She watched as Dr. Tom Hayes meticulously cut away the necrotic tissue and sutured the synthetic vessel into place. Councilman Whitaker's heart was successfully restarted, beating with a strong, rhythmic thud that felt like a miracle. Through it all, Dr. Richard, the legendary chief surgeon, remained sitting on a stool in the corner, staring at the floor. He refused to look at Chloe. When the surgery finally ended and the patient was wheeled to the surgical intensive care unit, Chloe retreated to the women's locker room. She stripped off her blood-stiffened scrubs, stepped into the scalding hot shower, and scrubbed her skin until it was raw. She had saved a man's life. She had done the impossible. Yet a heavy, dark dread settled over her chest. In the rigid, unforgiving hierarchy of medicine, stepping out of line was a cardinal sin, regardless of the outcome. Her fears were confirmed 20 minutes later. The overhead power system crackled to life. Miss Chloe Jenkins, report to the Chief of Medical Administration immediately. Chloe walked down the sterile white hallways of the executive wing, her stomach tying itself into painful knots. When she opened the heavy oak door to the administrative office, she felt the temperature drop. Sitting behind a massive mahogany desk was Dr. Tuah, Aris Thorne's successor, Dr. Leonard Gould, the stern and uncompromising head of administration. And sitting casually in one of the leather guest chairs was Dr. Shrew. Richard. He had showered, changed into a crisp, tailored suit, and completely regained his arrogant composure. The terrified, paralyzed man in the OR was gone. In his place was the apex predator of Boston General. "Sit down, Miss Jenkins, doctor," Gould said, his voice laced with absolute frost. Chloe took the seat furthest from Richard, keeping her hands folded tightly in her lap to hide their shaking. "I have just finished reading Dr. Richard's preliminary incident report regarding this morning's operation on Councilman Whitaker, Dr. Pott." Gould began pulling a piece of paper from a file. "It is, frankly, the most disturbing report I have read in my tenure at this hospital. Dr. Richard claims that during a critical, highly complex phase of the aneurysm repair, you suffered a catastrophic panic attack." Tuah, Chloe's head snapped up. "What? No, that's a lie." Dr. Gould slammed his hand on the desk. "Do not interrupt me. The report states that Dr. Burr." Richard paused the operation for a few seconds to visually assess a severe, unmapped anatomical anomaly in the aorta. "During this necessary pause, you allegedly panicked, physically assaulted the chief of surgery by shoving him away from the table, and blindly plunged a clamp into the patient's chest, causing severe tissue damage and nearly killing a prominent public official." Chloe stared at Richard in sheer absolute horror. The legend wasn't just throwing her under the bus, he was actively destroying her life to protect his own flawless reputation. Dr. Richard froze, Chloe pleaded, her voice cracking with desperation. His hands locked. He went completely catatonic. The patient was bleeding to death. "If I hadn't clamped that artery enough," Richard interrupted smoothly, his gravelly voice dripping with condescension. "Leonard, you can see she is still deeply unstable. I tried to guide her, but she simply broke under the pressure. It happens to young nurses who aren't built for the stress of a level 1 trauma environment. I had to summon Dr. Hayes simply because I needed to physically restrain her to prevent further harm to the patient." The sheer audacity of the lie took Chloe's breath away. It was a perfectly woven narrative. Who would the board believe? The god of cardiothoracic surgery with a flawless 30-year record, or a 24-year-old rookie nurse just 6 months out of school? "Effective immediately, you are suspended without pay, Dr. Doctor," Gould stated, closing the file. "Your badge is deactivated. A full disciplinary tribunal will be convened on Friday to formalize your termination and the permanent revocation of your nursing license. Furthermore, the hospital's legal team is reviewing the footage to determine if we will refer this matter to the district attorney for criminal assault charges. Turn in your ID, Jenkins, and get out of my hospital." Chloe walked out of the building into the cold Boston afternoon, stripped of her career, her dignity, and her future. The injustice of it burned in her throat like battery acid. She had done the right thing, and she was going to prison for it. The disciplinary tribunal was held 3 days later in the hospital's cavernous boardroom. It felt less like a hearing and more like an execution. Chloe sat alone at a long wooden table, looking small and exhausted. Across from her sat a terrifying array of hospital power, Dr. Vanessrum, Gould, 3 senior board members, a pair of ruthless hospital lawyers, and Dr. Richard, looking immensely satisfied. Let the record show that this tribunal is convened to finalize the termination and license revocation of Nurse Chloe Jenkins, Dr. Dunn," Gould announced, adjusting his microphone. "The charge is gross medical negligence, insubordination, and physical assault on a senior staff member. Dr. Richard, do you have any final remarks before we cast our votes?" "Not grot. Candon." Richard leaned forward, adopting an expression of fake benevolent pity. "Only that it brings me no joy to end a young woman's career. But the safety of our patients must always come first. Medicine requires discipline, and Ms. Jenkins severely lacks it. I strongly urge the board to proceed with criminal charges. We must set a precedent." "Thank you, Doctor," Gould nodded. "All those in favor of immediate termination, hold your vote." The heavy oak doors at the back of the boardroom swung open. The room fell into a stunned, offended silence. Walking down the center aisle was Thomas, the quiet, unassuming perfusionist who had run the bypass machine during the surgery. But he wasn't wearing his hospital scrubs today. He wore a sharp, federal-issued charcoal suit, and he carried a thick, black leather briefcase. "Mr. Kensington, Doctor," Gould snapped, his face turning purple with rage. "You are a perfusionist. You do not have the security clearance to be in this room. Security will escort you out immediately." "I don't think they will," Thomas said calmly. He reached into his suit jacket and tossed a heavy brass badge onto the polished wood of the boardroom table. It landed with a loud, authoritative clatter. "My name is Dr. Thomas Kensington. I am the lead medical auditor and senior investigator for the State Board of Medical Quality Assurance." Richard's smug expression instantly vanished, replaced by a chalky, sickly pallor. "For the past 6 months," Thomas continued, his voice echoing loudly in the silent room, "the State Board has received multiple anonymous tips regarding an alarming spike in post-operative complications and table deaths originating from Boston General's cardiothoracic department, specifically from surgeries helmed by Dr. Anastan. Richard, this is an outrage." Richard shouted, slamming his fist on the table. "You placed a spy in my OR? I placed myself in your OR to find the truth, because your administration was too busy protecting their cash cow to notice he was a liability." Thomas fired back, his eyes narrowing with icy authority. He snapped open his briefcase and pulled out a stack of documents, dropping them violently onto the table in front of Dr. Gould. "You want to talk about facts? Let's look at the bypass machine's black box data from Tuesday morning," Thomas said. At exactly 8:42 a.m., Councilman Whitaker's auto ruptured. The machine recorded a massive instantaneous drop in mean arterial pressure. According to Dr. Richard's fictional report, he paused to assess an anomaly. But the data shows that for exactly 47 seconds, no surgical intervention was attempted. No clamps were requested. No commands were given. The patient bled out 1.8 liters of blood, while the chief surgeon stood completely frozen. Dr. Gould looked at the data sheets, his hands beginning to tremble. "Furthermore," Thomas continued, turning his devastating gaze directly onto Richard, "I subpoenaed Dr. Richard's private medical records from out of state. For the past 2 years, he has been quietly seeking treatment in Connecticut for early-onset Parkinson's disease. His rigid paralysis in the OR wasn't a pause for thought. It was a neurological freezing episode triggered by stress. He knew his body was failing. He knew he was a danger to his patients. But his ego wouldn't let him put down the scalpel." The boardroom was dead silent. The hospital lawyers were suddenly frantically whispering to each other, realizing the sheer scale of the malpractice lawsuit that was about to rain down on them. "You tried to ruin this young woman's life to hide your own failing health," Thomas said, his voice dropping to a dangerous low register. "That is the definition of cowardice." Thomas turned back to the board. "If you terminate Nurse Jenkins, the State Board will revoke the operating license of Boston General Memorial Hospital by the end of the day." Nurse Jenkins didn't panic. She recognized a lethal failure in the chain of command. She broke the rules to save a dying man, and she performed a flawless, blind vascular clamping that seasoned surgeons couldn't pull off. She is the only reason you don't have a dead city councilman on your hands. Hard karma had arrived, and it was absolute. Within an hour, the tables had completely turned. Dr. Richard was stripped of his medical license, escorted out of the hospital by security, and informed that he would be facing immense civil and criminal liabilities. The hospital administration, terrified of the state board, immediately reinstated Chloe Jenkins, tearing up the suspension and offering her a full promotion to head surgical charge nurse. Chloe walked out of the hospital that evening, pulling her jacket tight against the chill. She took a deep breath of the crisp Boston air. The weight of the world was off her shoulders. She had faced the god of the operating room, survived the fire, and proven that true authority doesn't come from a title or a reputation. True authority comes from having the courage to act when lives are on the line. Did Chloe's bravery leave you speechless? The medical world is full of hidden heroes who risk everything to do what is right. If you loved this intense story of medical justice and hard karma, please hit the like button, share this video with your friends, and subscribe to our channel. Your support helps us bring more gripping, real-life dramatic stories straight to your screen. Thank you for watching today.